When we think about health risks, we usually think about things like smoking, diet, or exercise. But a major new study shows that something much less obvious can also have serious effects on your health: social disconnectedness. Researchers from Denmark recently studied over 162,000 people from the Danish National Health Survey and tracked their health over several years. They looked at three aspects of social disconnectedness: loneliness, social isolation, and low social support. Then they followed these individuals to see who developed medical conditions over time. The results were striking. People who felt lonely or lacked social support had a significantly higher risk of developing a wide range of illnesses, from heart disease and diabetes to dementia and musculoskeletal disorders. In fact, loneliness seemed to be an even stronger risk factor than social isolation or low social support. The researchers found that loneliness increased the incidence rate for all 11 categories of medical conditions they studied. These included mental disorders, dementia, circulatory conditions, pulmonary diseases, endocrine issues like diabetes, and even some forms of cancer. For example, people who reported feeling lonely were over 3 times more likely to develop a new mental disorder compared to those who did not feel lonely. The risk increase for other conditions was also substantial, though slightly lower. Interestingly, being socially isolated also raised the risk for most diseases, but the effect was a bit weaker compared to loneliness. Meanwhile, low social support, feeling like you have no one to talk to, was also associated with higher risks across many illnesses. The study carefully adjusted for many other factors, such as age, sex, education, income, and wealth. That means the connection between social disconnectedness and later illness isn't just about being poor or old. It's about the deep health consequences of feeling alone or unsupported. So what could explain these effects? The researchers suggest several possible pathways. One is that loneliness affects behavior. People who are lonely may be less likely to exercise, more likely to smoke, or more prone to unhealthy eating. Another pathway could be psychological. Loneliness can increase stress and reduce resilience, making it harder to cope with life's challenges. Finally, there's a biological pathway. Loneliness can lead to increased inflammation, hormonal changes, and damage to the immune system, all of which can accelerate the development of diseases. Importantly, the study also found some differences by age and sex. For example, younger people who were socially disconnected seem to have an even stronger risk of developing mental disorders than older people. There were also subtle differences in how certain diseases, like musculoskeletal or urogenital conditions, were associated with loneliness between men and women. However, one interesting finding was that having a pre-existing mental disorder, like depression, did not drastically change the relationship between social disconnectedness and new medical illnesses. This suggests that loneliness and isolation have independent effects on future physical health, even beyond their connection to mental health problems. What does all of this mean for you? It means that social connections are not just nice to have, they are essential for your long-term health. Taking loneliness seriously isn't just about emotional well-being, it's a matter of physical health too. Building and maintaining relationships, seeking social support, and helping others feel connected could all be powerful ways to protect yourself and others from serious illness later on. The takeaway is simple. Invest in your social relationships, just like you invest in your physical health. Because the risks of loneliness are real, and they reach far beyond the mind into the body.